Initially, we'll start with an aggressive aquablation protocol to make sure that we aquablate as much tissue as possible. What I love about aquablation is that when you initially start, you can see that we'll have a beautiful preservation of the apex. And then I'll start working on the bladder neck right away. I'm working circumferentially, resecting the tissue, using the Sinha back and forth technique, and cauterizing as I go along. But the key thing is to move very fast. I break the procedure down into about 10 to 15 minutes for the aquablation part, and then 10 to 15 minutes to resect the entire bladder neck and achieve hemostasis. The key thing is to keep moving and to stay efficient. I'll also work on the anterior channel. So you'll see that when I first start, I'll start anteriorly and create a nice anterior channel all the way through to the apex. And what this does is allows for great irrigation, so you'll see a lot better. Then when you come down to the lateral and the floor tissues, you'll be able to see a lot better. I'll come back now, once I've created the bladder neck and opened it up widely, I'll come back and sit at the verumontanum and then look and see if there's any fluff kind of in the mid and the apical areas. I'll go ahead and resect that, do a few swipes. And then the next and most important thing is to switch to floating cautery in the mid and apical areas. You really want to leave some of the fluff tissue alone in these areas because it has a hemostatic property to it. When you reach an area that's continuing to bleed and you're cauterizing or floating above the fluff and doesn't seem to be responding, move to the opposite area. I find that this helps to really achieve that hemostasis. The key is to fight that temptation to want to dig in and dig deep into that tissue, then you'll get into more bleeding. So avoid that temptation and just continue the floating cautery and keep moving around circumferentially. And what you'll see is that eventually this becomes really nice and clear. Our goal is to not use any traction or CBI post-op. So you want this channel to look crystal clear. As you can see, we've just been working around circumferentially, spend about 10 or 15 minutes. Keep working around, going in a circle, and you see how this clears up beautifully. I'll turn off the flow and make sure it's crystal clear. So that way we want the urine to look like this at the end.